Welcome to Raaonline. Today we are going to discuss a case of cerebellar syndrome. So the case came to a neurology OPD. So the case goes like this, and obviously we have to talk about the related anatomy, but let's first identify the case and then only we can describe the structure in detail. So a 60-year-old man presented in neurology OPD with giddiness, ataxia, tremors and inability to perform skilled movements last 2 months. So last 2 months onwards he had this giddiness, ataxia and tremors, and on examination the Romberg sign was positive and he had difficulty in walking in a straight line. Finger nose finger test also showed past pointing. So with this kind of a history, when we are so straightforward, we are saying to you that the Romberg sign was positive. Definitely, the first thing which will come whenever there is an ataxia or a balance disturbance and with some kind of tremors, it may be an intentional tremors may not be mentioned in the history because that we elicit on examination. So in these kind of movement disorders, and with intentional tremors and not able to hold the balance properly, there is also some amount of giddiness because of vestibular involvement. So all these things will actually point towards a cerebellum. So mostly we are dealing with a case of cerebellar ataxia or a cerebellar syndrome because it has combination of so many factors with it. So when we have to describe the structure involved, so definitely first we have to tell what is the structure involved and then describe the anatomy of the structure involved, its connections, its blood supply, its circuit and histology and everything. It will come as an essay question, so everything will be asked to you. So let's start the question. I'll be starting with the cerebellar anatomy. So now coming to the cerebellum. So what is the cerebellum? Cerebellum is a little brain. Cerebellum is also called a little brain. It is the largest part of the hindbrain. It is weighing about 150 grams and situated in the posterior cranial fossa beneath the tentorium cerebelli. So it is just beneath the tentorium cerebelli, beneath the posterior cranial fossa. It is in the posterior cranial fossa and it is anteriorly separated from the pons and the medulla by the cavity of the fourth ventricle. Now if you concentrate on this image over here, you can see that you are having the brain stem over here, that is the medulla oblongata is here, and then we have the pons, we have the midbrain. So brain stem is like a stem-like structure. So definitely the spinal cord will be continuing as medulla oblongata, and this is actually where you have the foramen magnum. And foramen magnum is actually having the medulla oblongata will be passing through the foramen magnum. Only after it passes through the foramen magnum and at the level of C1 vertebra only it will become the spinal cord. So then you have the pons and you have the midbrain. So what is this cerebellum? This cerebellum is situated just behind the brainstem. So it's just on the dorsal aspect of the brainstem. And the gap between the cerebellum, pons and medulla oblongata, you can see a gap over here. It's like a tent-like. It's a triangular gap, okay? And this is actually filled with cerebrospinal fluid. And this is the fourth ventricle over here. So this is how we introduce the cerebellum. It is a part of the hindbrain. It is also called the largest part of the hindbrain. Now what is the hindbrain? So we know what is brainstem. So brainstem is mainly made up of three things, right? So you have the medulla oblongata, you have the pons and you have the midbrain. No? But what is hindbrain? So if we say about hindbrain, that is also three things, okay? So hindbrain we are having medulla oblongata, we are having pons and we are also having the cerebellum. So basically the cerebellum is a part of hindbrain. The weight of the cerebellum, coming to the weight, so definitely this cerebellum is the largest part of the hindbrain because medulla oblongata, pons and cerebellum together will form the hindbrain. Midbrain won't come in the hindbrain, okay? As the name suggests, you cannot put midbrain in the hindbrain. Situated where? Where is this cerebellum situated? 150 grams in weight. Where is it situated? It is situated in the posterior cranial fossa. Now if we remember, the dural folds you have the tentorium cerebelli above this. That is the dural fold. And there is a small dural fold will go in between the two cerebellar hemispheres, and that is the falx cerebri. So these are the dural folds which are associated with the cerebellum. One of the ventricular cavity is associated with the cerebellum, is the fourth ventricle. It is dorsal in situation in the posterior cranial fossa. Okay, it is also posterior to or dorsal to the pons and the medulla oblongata. Intimately related to the midbrain, pons and medulla oblongata, it has connections to all these three parts of the brain stem. What is the function of cerebellum? To introduce cerebellum to you, why is it so important? So it is responsible for equilibrium. That's why the patient actually presented with balance disorders. No, so it is definitely resulting in equilibrium. So it is very important for equilibrium. It is important for muscle tone. So tone of the muscle, okay, to maintain the tone. Skillful, and definitely they are part of the cerebellum which is very, very evolved in human beings. That is the NEOCEREBELLUM. We'll come to that in the subsequent slides. And that NEOCEREBELLUM is responsible for skillful, coordinated performance of voluntary activities. Now we have to remember that they are more for voluntary activities, not for involuntary. Skillful, coordinated action of voluntary activities. Involuntary system also it has action. It actually maintains the tone, the posture, all these things are maintained involuntarily. But whenever you are trying to do some skillful repetitive actions and you try to learn those and perform those like dance and all that, cerebellum is the main thing which is very, very important in conducting this skillful voluntary activity, because it controls the entire activity. That is especially the more refined activities, more refined movements and skillful movements. This is the place which controls it. Okay, so once we have this introduction about cerebellum, it is a little brain and it can come as an essay question for you. It will be ECE, that is, it will be an early clinical exposure question in anatomy. As such, in medicine, when you study medicine also, you have to go into different kinds of connections of cerebellum, and you should know what are the disorders, which are the syndrome, cerebellar syndrome, and what are the disorders. Even in physiology, cerebellum is very important. Cerebellar ataxia is a main question. So it has a very huge significance. Cerebellum has a huge significance in your curriculum. Okay, so if we see this diagram, we can see this is a specimen. Okay, and we are seeing this is a brain specimen. So this part is the cerebrum. Okay, so this is a superior lateral surface. We are seeing the lateral part. And if you see below, so this is the entire brain has been removed. And then if you see a little below how it continues, you can see over here we are seeing the brain stem. Okay, so this is like a stem-like structure, so brain stem. And just below the cerebrum, we are having the cerebellum. So this is the cerebellum which is situated just below the cerebrum. So this is this structure, 150 grams. And it is also called the little brain because this is the major brain and this looks like a small brain. So this is the little brain, just like a replica of cerebrum with two cerebellar hemispheres. So this is actually the specimen which is removed from the cadaver and it is being shown to you. Okay, now coming to a basic connections for you to understand that the cerebellum, I told you, is intimately connected to the midbrain stem. So what are the parts of the brain stem? Already we talked about it. You have the midbrain, you have the pons, you have the medulla oblongata. So it is connected to the three parts of the brain stem by three pairs of cerebellar peduncles. Okay, so we have three pairs of cerebellar peduncles which are connecting the cerebellum to the three different parts of the brain stem. So first is the medulla oblongata, which is down, and then you have the pons in the center, and then you have the midbrain on the top. Okay, so it is connected that way. So medulla oblongata, it is connected through the inferior cerebellar peduncle. So medulla oblongata, inferior cerebellar peduncle is connecting the cerebellum with the medulla oblongata because it is the lowermost. So what do you mean by peduncle? Peduncles are nothing but white matter, okay, and they are connections. So it is forming like a bundle, okay, so it is forming like a stalk or a peduncle. So it's like a stalk and it is well connected because the connections are passing through that. Connections are nothing but axons of the nerve cells or the neurons. So axons will be passing through that. So you are having the inferior cerebellar peduncle, which will be connecting the lowermost part, as the name suggests, inferior. So lowermost part of the brainstem is medulla oblongata, which will be connected to the cerebellum through the lowermost part. Next you come to the middle part of the brainstem, that is the pons. So pons is connected to the cerebellum through the middle cerebellar peduncle. This is extremely important because this peduncle is actually going to come for your spot identification also. It is very clearly visible and it is also going to transmit the only afferent fibers to the cerebellum. It is not going to take any output from the cerebellum. It is only going to give input to the cerebellum. That's why it is a very, very important peduncle which will come in your spot identifier. Okay, and the next peduncle which is connecting the cerebellum with the brainstem or the uppermost part of the brainstem is the midbrain. Okay, so that is the superior cerebellar peduncle. You have the connection of the cerebellum to the midbrain. Okay, so once we know that the cerebellum is intimately connected to the brainstem, through this brainstem itself, it will be talking to the cerebrum and to other parts of the CNS. So every part of the brain, whenever we talk about the brain, every part of the brain will be interacting with each other. Then only you are getting a very coordinated activities, all activities or emotion, everything is related to each other. And that's why we have to know the connections of cerebellum. Not only the structure as it is, but how is it connected, because the function is associated with the connections. Coming to the gross features of cerebellum, the cerebellum will be having three parts. It has three surfaces, okay, and then two notches and three fissures, which you have to remember. So two notches are there. So there is an anterior notch and there is a posterior notch. It has surfaces, two surfaces. It has a superior surface and an inferior surface because it is curving like this. So you have a superior surface over here and you have an inferior surface below. You have three fissures which are also very important. Okay, now coming to the details of this. So as such, the cerebellum will be having two hemispheres. So this is one hemisphere and this is one hemisphere. So right and the left hemisphere, and midline, these hemispheres are connected by a worm-like structure in the midline, which is called the vermis. So vermis is made up of, you have a superior part of the vermis and an inferior part of the vermis. So as the cerebellum is getting folded, so the cerebellum is something like this. It is also getting folded like this. So if you see from the profile view, you have a superior part of the cerebellum, you have an inferior part of the cerebellum. The vermis is also going like this in the center. So you have a superior part, you have an inferior part, and you have a fissure which will be separating the superior surface from the inferior surface of the cerebellum. So it's like curved. It's like not only on the superior surface, it is also going to the inferior surface. So now superior vermis is continuous with the divisions of the cerebellar hemispheres laterally. So if you see, this is the vermis. So if I point you the vermis, it will be in the center. So this part of the cerebellum is called the vermis. Okay, and it is obviously present on the superior surface also, and it goes to the inferior surface also, because the cerebellum folds and goes to the inferior surface. It is continuous laterally. On the lateral side, you have one hemisphere. On this side, you have the other hemisphere. So there are two hemispheres over here. So left and right hemisphere, and this is the vermis on that. Inferior vermis, how it continues? When the inferior vermis has to continue, here there is a notch-like structure posteriorly, because between this notch only you are getting the falx cerebelli, which will be entering between this notch. So that is the notch which goes into the cerebellar hemispheres. So that's why you are having a inferior vermis. So it will be lying on the floor of this notch. This vermis will be turning and going inferiorly and lie in the floor of this notch. So it is like it is present on the superior surface and it goes inferior surface, and this notch in the posterior part where the falx cerebelli. So this is what? Falx cerebelli, not cerebri. This is within the cerebellum. So it is cerebelli. So falx cerebelli is going between the two. It is called the vallecula. So this notch is known as the vallecula. So this is the vallecula of the cerebellum. We are talking about the cerebellum here and not the cerebrum. Okay, and it also has an anterior notch, you can see over here. So we'll come to the following things. So let's come to the surfaces. So if you see, this is the superior surface. So over here you are seeing the superior surface. So this will be facing the cerebrum. So just below the cerebrum, this is the surface, but both will be separated from each other by the tentorium cerebelli. So I said two dural folds are associated with the cerebellum. One is the tentorium cerebelli and one is the falx cerebelli. So it will be separated from the cerebrum, but it is facing the cerebrum. It is above. So superior surface is this. Now when we turn it over or when we look from down, okay, this is showing you the inferior surface of the cerebellum. And you can see once we turn this around, this is the inferior surface which is downwards towards the spinal cord or sitting in the posterior cranial fossa. Okay, so this is the inferior surface. So two cerebellar hemispheres which are continuous with each other. Inferior surface will present a deep notch. So this is the deep notch in the inferior surface which I already told you, that is the vallecula. So you can see over here, this is the inferior surface showing you the vallecula and separates the two cerebellar hemispheres. So there is also a fissure over here. So we'll come to the fissures and the foliars of cerebellum. So now coming to the other things, another important thing which I wanted to tell you in the previous slide, but this is the two notches. So we talked about two notches, right? So this is the anterior notch. Okay, into this what will fit? You remember that the cerebellum is just behind the pons and the medulla oblongata. So if you have a notch over here, definitely the brainstem is going to fit into it. That is, the pons and medulla is going to fit into it. So you can see the lower part of the pons, upper part of the medulla oblongata is fitting into this. So into this notch, it is just fitting. So cerebellum is coming all over, right? So it is fitting into this like a socket. It goes and fits into it. Next is posterior cerebellar notch. I already talked about that. That is called the vallecula. It is a depression and that will continue as the vallecula, and this is the depression where what will fit into it? That is the falx cerebelli, is the dural fold which is specifically for separating the two cerebellar hemispheres. So this will come and fit into it. Okay. So coming to the fissures. Now if you concentrate on the surface of the cerebellum, you can see that multiple lines are being drawn on the cerebellum. So the cerebellum is looks like as if it is like cut by multiple lines, and these are called the fissures. So it has multiple lines and it has lot of folds. Actually these fissures are nothing but depression and elevation. Foliars are elevations and fissures are depressions. So cut depressions. It is a very sharp depressions. So the structure of the cerebellum is like that it has multiple sharp folds which are dividing the surface of the cerebellum, increasing the surface area of the cerebellum. That is very important. The main purpose of having these folds or fissures is mainly to increase the surface area. So this has multiple fissures, and three important fissures are very important which you will consider in cerebellum. So one is the horizontal fissure. So one comes the horizontal fissure. So horizontal fissure is something which separates the superior surface of the cerebellum from the inferior surface of the cerebellum. So that fissure is between the superior surface and inferior surface. We are not using the horizontal fissure to separate any lobes or anything. Now coming to another important fissure, in the anterior aspect we have the fissura prima. So this is the fissura prima. In the anterior aspect you can see or situated on the superior surface at the junction of the anterior 2/3 and posterior 1/3. So junction of anterior 2/3, posterior 1/3 of the superior surface, and this is the fissura prima. This is going to separate the cerebellum into lobes. You have an anterior lobe, the middle or the posterior lobe, and the flocculonodular lobe on the inferior surface. So this is one of the fissure which is going to separate the cerebellum into lobes. So this is the fissura prima. Sorry, this is the fissura prima. So this becomes the fissura prima, which is going to separate the cerebellum into two major lobes. Okay, and now coming to the posterior lateral fissure. Now what we are seeing over here is the inferior surface of the cerebellum. So inferior surface of the cerebellum. So once we have turned and we are seeing the inferior surface, you can see a fissure between the main body of the cerebellum, the entire cerebellum, and a small, very small part in the inferior surface anteriorly. So this is anteriorly, this is posterior, this is the vallecula. Okay, and this is actually the posterior lateral fissure. So the posterior lateral fissure is separating the entire body of the cerebellum from the flocculonodular lobe, which is situated on the inferior surface. So this is again separating and forming another lobe over here, which is the flocculonodular lobe, and this lobation of cerebellum is based on the gross features. So this is mainly on gross features. How many fissures we are seeing? We are not lobating or not separating the lobes according to the function of the cerebellum as such, but as some part of the middle lobe will also have a function of the anterior lobe. So that's why it is based on the gross features. Okay, so this is the inferior surface, which is showing you the basically the this thing. So inferior surface showing you the flocculonodular lobe. It is showing you the posterior lateral fissure, and thus we are separating the middle lobe or a posterior lobe from the flocculonodular lobe with the help of the posterior lateral fissure. Okay, so we have seen these three fissures which are very important. One fissure is horizontal fissure to separate the superior surface from the inferior surface. Other two fissures like fissura prima and the posterior lateral fissure are helping you to separate the cerebellum into three lobes. Okay, so now coming to the subdivisions. So let's see the subdivisions now. So you have three lobes. I already told you, you have three lobes. That is the anterior lobe, the posterior or the middle lobe, and the flocculonodular lobe. So anterior lobe is present over here, and then you have a posterior or a middle lobe, this whole entire thing, and this brown color structure which is coming out and separated by the posterior lateral fissure is the flocculonodular lobe. Now you have to remember, this is the entire cerebellum. We are seeing it in this flattened out plane. Here the cerebellum, this part only is the superior surface and this part is actually the inferior surface. But here we have flattened the inferior surface and we are seeing the cerebellum as a flat structure. So basically it was turning like this. Now we have made it flat like this. Okay, and seeing. So this was the superior surface, this was the inferior surface. Okay. And so this part, so up to this was the superior surface and from here was the inferior surface, right? So it was actually turned like this, turned inside. So this was anterior. So now we have flattened the cerebellum and we are seeing the cerebellum on a flat plate. You have to imagine like that. It is on a flat plate. And so we are getting this horizontal fissure. We are getting the fissura prima over here. Okay. Sorry, not that. Fissura prima is somewhere here. So you can see over here, that is the color difference is coming. And then this is the posterior lateral fissure over here. Okay. So we have now flattened. We have not seen the superior surface and inferior surface separately. In this diagram, we are seeing the superior surface, inferior surface together. And we are identifying the three most important fissures which are helpful for as a gross feature of cerebellum. So what is this anterior lobe of the cerebellum? It is anterior to the fissura prima. You can see it is anterior to the fissura prima. And this part of the cerebellum, what I said to you, that it is the vermis of the cerebellum. So this part of the cerebellum was the vermis of the cerebellum. These two parts of the cerebellum are the cerebellar hemispheres. So this one is one hemisphere and this one is another hemisphere. So these two parts are hemisphere which are connected to each other by this worm-like structure which is called the vermis. So if you see. Now posterior lobe or between the fissura prima and the posterior lateral fissure. This is called the posterior lobe or the middle lobe. It is also called the middle lobe. So some books will say that it is posterior lobe. Some books will say that it is middle lobe. Okay. So it is behind the fissura prima but it is in front of the posterior lateral fissure. Okay. Now coming to the other lobe, another lobe which is the flocculonodular lobe. So you can see over here This is the flocculonodular lobe. And smallest, it lies on the inferior surface in front of the posterior lateral fissure. So it is anterior. So it is turned like this. The cerebellum is turned. So it is going front of the posterior lateral fissure. So it is on the smallest and lies on the inferior surface in front of the posterior lateral fissure. So that is what is the flocculonodular lobe. Now coming to the subdivisions of the vermis. So if we look at the vermis and the hemispheres, you don't have to remember all these complicated names except a few things which I will tell you, which you have to remember. So if we see the vermis, the anterior most part of the vermis is called the lingula. So this anterior most part of the vermis, which is also coming in the anterior lobe, but functionally it won't be related to the anterior lobe, that is called the lingula. Then we have the central lobule, the culmen, the declive, the folium, the tuber, pyramid, uvula and the nodule with the flocculonodular lobe. Similarly, the entire hemisphere is also being given different names depending upon the fissures and their functions. So you have the ala, the anterior quadrate tubercle, the posterior quadrate tubercle, lobule, and then superior semilunar lobule, inferior semilunar lobule, gracile lobule, biventral lobule, tonsils. So tonsils are in the posterior or the middle lobe. And then this comes the horizontal fissure, which shows you this is the superior surface and this is the inferior surface, and these are the three lobes. Okay. So now let's come to the subdivisions of cerebellum. So you have the three types of cerebellum. You have the archicerebellum or the vestibular cerebellum. Then you have the paleocerebellum or the spinal cerebellum. Then you have the neocerebellum or the cerebral cerebellum. So if you classify the cerebellum depending upon the morphology or the functions, we are getting three types of cerebellum. So you have three lobes. Functionally also we are going to have three lobes. So we are having an archicerebellum or a vestibular cerebellum, which is an old cerebellum. Archi means old. Paleo means the next to develop. So spinal cerebellum, which is paleo, and neocerebellum is the latest. I told you that cerebellum is something which is very well evolved in the human being, especially the neocerebellum, for skilled coordinated voluntary motor activities. Okay, so that is the cerebral cerebellum. So coming to the archicerebellum, so if we go for functionally, if we think morphologically and how it has evolved and functionally, then it is not going to follow the same type of classification as anatomical gross feature classification. Okay, so here archicerebellum is the phylogenetically oldest part of the cerebellum, and it is mainly in case of fishes and amphibians. It is well developed. So first, the things which were developed, the lower part of the animal kingdom, that is the fishes and amphibia of the vertebrates. So these are the first thing to develop the cerebellum. The part of the cerebellum which has first developed is the archicerebellum. And what are the parts of the cerebellum which is developed first is the flocculonodular lobe and the lingula. So if you see, this is the nodule, this is the flocculonodular lobe, and this is the lingula, which is drawn in the brown color. So this lingula is a part of the anterior lobe, but it comes very close because this folds, right, and comes very close to the flocculonodular lobe and the nodule, because the vermis folds like this. So this part, lingula and the nodule and the flocculonodular lobe together will have chiefly vestibular connections. So it will maintain equilibrium, it will maintain tone, it will maintain posture of the trunk muscles. So mainly it is going to have a lot of functions, vestibular connections and equilibrium, that is balance. So basically it will keep the body in a proper balance. So that is the main action of this flocculonodular lobe or the archicerebellum or the vestibular cerebellum. And this is the first part of the cerebellum to develop, very well developed in case of fishes and amphibians. Paleocerebellum. Next coming to the cerebellum is the paleocerebellum. So next part to appear in the terrestrial vertebrates with the development of limbs, that is reptiles, and you are also having the birds, you are getting the paleocerebellum. Next, what is it? That is the anterior lobe, except what are the paleocerebellum? It will not follow the anatomical lobation, I told you. So definitely the anterior lobe is a part of this thing, but the lingula is not a part of paleocerebellum. It is not a part because it is a part of vestibular cerebellum. So what is becoming the part of paliocerebellum? You are having the anterior lobe, pyramid and uvula of the inferior vermis. So pyramid and uvula of the inferior vermis. So coming to the paliocerebellum or spinal cerebellum, which is the next part to appear in the terrestrial vertebrates. So that is in reptiles and birds. I told you already that the anterior lobe will be part of the paliocerebellum, but there are portions of the anterior lobe which will not be included in the paliocerebellum, that is the lingula. And what is included in the paliocerebellum, not from the anterior lobe but from the middle or the posterior lobe, is the pyramid and the uvula. So that will be included in the paliocerebellum. So it is a spinocerebellar in connections. And what is it? It will also maintain the tone and posture and crude movements of the limbs. So tone, posture and crude movements. So you have to remember that the vestibular cerebellum was actually with equilibrium and balance, whereas the paliocerebellum is with tone, posture and crude movements of the limbs. So this is becoming a little more evolved. So that's why we are climbing in the animal kingdom. So if you see, now it is more developed, it is well developed in reptiles and birds. Definitely it will be developed in humans, but this is the next cerebellum to appear morphologically. So the functions will be similar. So if you see, definitely the anterior lobe has spinal connection. So spinal cerebellum or paliocerebellum, except the lingula, because lingula is more connected with vestibular cerebellum and vestibular nuclei. And what is there more addition to that is you are having the pyramid and the uvula of the vermis. So these two sections are also included within the paliocerebellum, though they belong to the middle or the posterior lobe. Okay. So that is the second type of cerebellum which has developed according to development or morphological or according to function also. Next, coming to the most important and most recent part of the cerebellum to develop and which has really evolved very well in case of humans, and that we are getting the neocerebellum or the cerebral cerebellum. So this is the neocerebellum or the cerebral cerebellum, most recent part to develop. It develops in primates along with enlargement of telencephalon and cerebral cortex. So if you see that this is the most developed part of the cerebellum, it is also most largest part of the cerebellum. Okay, because it is mainly well developed in higher mammals like humans and monkeys and all that. So higher mammals. So middle lobe, what is the constituents of neocerebellum? You have mainly the middle lobe, because middle lobe is the largest lobe. Middle lobe, but remember that the pyramid and uvula which was there in the middle lobe vermis is not included in the in this neocerebellum. They are a part of the spinal cerebellum. Okay, along with the other part of the anterior lobe, they are the part of spinal cerebellum. Okay, or it is actually that is the paliocerebellum. So we just now spoke about this. So now neocerebellum is mainly of the middle lobe, but except the pyramid and uvula. So it has cortico-pontocerebellar connections. So that is very important. This neocerebellum is receiving impulses directly from the cerebral cortex, especially the motor area and the premotor cortex, because it is concerned with motor activities more. And how does it receive? It receives through the pons, because from the cerebrum the connection fibers will come and descend and they will actually synapse at the pons, the pontine nuclei, and from there it will pass into the cerebellum through the middle cerebellar peduncle. I told you that the middle cerebellar peduncle is extremely important because it will only carry afferent fibers, afferent informations, that is input to the cerebellum indirectly from the cerebrum through the pons. Okay, so it mainly is cortico-pontocerebellar in connection. It has smooth performance. It is very important for smooth performance of skilled voluntary activities. So smooth performance of skilled voluntary activities. So according to the functions or the morphological development or how it has developed, we have classified cerebellum into 3 divisions. That is, you are having the vestibular cerebellum, the spinal cerebellum and the cerebral cerebellum. That's why, because it has maximum connections from the cerebrum. So, or the higher brain, right, or the big brain. So, it is from the cerebrum, the motor cortex, the premotor area, all these things are connecting with the cerebellum. Even the other parts of the cerebrum will be connecting with the cerebellum. So, that's why this part is most developed and it is called the neocerebellum. So, each part of the brain, that's what I told you in the beginning, that each part of the brain, whether it is a higher brain or it is the hind brain or mid brain, will intercommunicate, will talk to each other. Then only it won't be working independently. It has to bring about a coordinated action. So, the cerebrum will be controlling the cerebellum. The spinal cerebellum is mainly having connections with the spinal cord. So, that will be controlling the cerebellum, and cerebellum will be otherwise controlling the spinal activities also. And the vestibular system, that is your archicerebellum, that is the vestibular nuclei, will be also connected to the cerebellum. So, this is the way how we divide the functional classification of cerebellum, which is not similar to the anatomical classification of cerebellum. Okay.